I'm Dr. Pallavi, IVF Specialist at Nova Fertility Center, Tamram. In this video, I'm going to talk about what is the procedure of IVF. In IVF, usually selection of the patient is very important. Once you have selected patient for IVF, usually we will ask them to come on day 1 or day 2. Usually day 2 we will call and we will see first scan. In scan we will see what is the number of eggs. Usually this procedure will be done before starting of IVF. So day 2 we see the scan and any cyst is there or not we will see. If there is no cyst, we will ask for some hormone test, and hormone test everything within normal limits. We can start injections. So at least 5-6 days we will give injection, and after that we redo scan and see the response of the injection. Once we will get a good size of the follicle, then we give trigger injection. This is a final injection for maturity of eggs. After that, giving trigger injection, after 36 hours of trigger injection, we will ask them to come and get admit for egg collection. This egg collection is we have to do in theater under sedation. So transvaginally we will pass that scan probe, and through the probe we can transfer that needle and aspirate the eggs from the ovary. So our embryologist, they will examine those eggs under microscope, and good quality eggs they will take it, and at the same day husband has to come and give semen sample, and we will select a good quality sperms and we will inject inside the oocyte. So there are two procedures are there, like one is IVF and one is ICSI. If we have sufficient number of sperms, we can advise IVF. IVF is nothing but we will keep oocyte in the same petri dish. We can put a sperms. So naturally the sperms will go and meet a sperm and form embryo. In ICSI what we do, we will inject a sperm inside the egg. So we will select one sperm and inject inside the egg. This is ICSI procedure. After doing ICSI, we will keep in incubators, and we will see after 18 to 24 hours and see the quality of embryos, and we will update to the patient about the quality of embryos after fertilization and on day 3 and day 5. Usually we will take all embryos till day 5. And in case we are freezing, because depending on the number of embryos and uterine lining, the same cycle of transferring embryo or next cycle we will decide and inform to the patient. So like this, in case we are not transferring in the same cycle, we will freeze embryos like this in the cans. So these are the embryos. Day 1 embryo will look like this, and day 2 look like this, and day 3 embryos will look like this, and day 5. Maximum we will take all embryos to day 5 and we will transfer embryo. Thank you.